Hi everyone, welcome. My name is Tanisha Sally. I've been working with children with mental disorder for the past 13 years. Today I welcome all my new teachers and anyone else from a different profession joining us today. Today we'll be looking at dyspraxia, atypical development. Let's begin. Development is an adaptive change toward competence. Children are expected to adapt to physical, social changes which will affect their holistic development from childhood to adulthood. Atypical development is when development does not follow the normal developmental milestone or changes. How children pass through these milestones will indicate their level of progress. This presentation will look at what dyspraxia is, what characterizes it, the diagnostic methods and techniques used globally and in Jamaica, and early intervention and the effects of the early intervention for families with children with dyspraxia. What is dyspraxia? So dyspraxia is a brain-based condition that makes it hard to plan and coordinate physical movement. There is no known cause for this condition, although it is thought to be an immaturity of neuron development in the brain rather than brain damage. So if the brain is not developing accordingly, a child will have challenges doing normal activities such as jumping, balancing. Among a group of children, it was observed that this child had difficulty getting dressed, fidget more than other children. So even though these symptoms are related to dyspraxia, it cannot be assumed that the child has dyspraxia without being examined by a doctor. What characterizes dyspraxia? So dyspraxia is characterized as a disorder that affects one's communication, emotional, academic, overall skills. So for example, preschoolers speak slowly or does not enunciate words. Children with dyspraxia are not less intelligent than others, but what dyspraxia does is it causes learning to be difficult, makes it hard to plan and execute the diagnostic methods and techniques. So here in Jamaica, Microcare as an institution will assess children with developmental disorder. So first they would have to be referred to the center. An application will have to be done, documents reviewed by the intake committee, and the intake process normally takes place over a 3-day period where you even have social workers conducting investigation in the child's family and home situation. Diagnostic method globally is that various tests are also being done. So you have the child visiting the general practitioner first. Specialists will interview the parent about their concern and observation. Specialists will also test your child's ability to carry out physical tasks. So to diagnose your child with dyspraxia, the specialists need to make 4 key findings. One of such is it that motor skills lag behind what is expected based on the child's age, or were these symptoms present early in life even though the condition is not typically diagnosed before age 5. So if your child has dyspraxia, treatment can help. Early intervention by teachers. So preschooler teachers, you're encouraged to integrate physical activities into your classroom, right? Such as and workout before and writing session. Another thing that you can do is to set up your classroom with an array of fine motor resources. Ensure that children are seated appropriately by providing lower tables, chairs where possible. So the aim is to help each child through their challenging tasks and overcoming them eventually. Early intervention for families, right? So the occupational therapists refer long-term effect of early intervention. So they encourage individual skills. So the therapist will help your child focus on developing gross and fine motor coordination, right? They will also encourage environmental intervention, so modification of equipment to make it easier for children to find and reach stuff, that helps. So they encourage activity intervention, right? So children are given more activity in the area that they have the challenge in, so that they be able to master such tasks. And I will conclude here by saying that a child's holistic development and growth are crucial to their future. So therefore, early intervention, family working together, organizing skills for the children will benefit families and children with dyspraxia. I thank you.